Good morning. It's October 4, 2023, and we welcome you to your program, your agenda, and we thank you for being Cignal TV subscribers and viewers of One News on channels 8 and 250. Maraming salamat po because your support really makes a big difference for us, and it gives meaning to all the work we do here, especially the work done by Team Agenda. Marami po sa kanila, madaling araw pa lang, they wake up even before the chickens start crowing. So we thank you for being with us. Of course, we appreciate the support of PLDT Home Fiber Optic Internet, supportang technical technology, because anywhere we go, basta may PLDT Home Fiber Optic Internet, buhay ang agenda. Anyway, today, it's a Wednesday, October 4, 2023, and today we are going to focus on a very important subject matter that many people, even the media, have ignored lately. A few years back, before COVID, when we talked about dengue, everybody was paying attention. It was the focus. And then suddenly after COVID, parang hindi nyo na pinapansin. Unfortunately, just like cases of measles, cases of dengue has been on the rise, and later when you watch our video package or video intro on the subject, you might get the shock of your life how much dengue has disrupted the world and even the Philippines. So we will talk about all of that from two healthcare experts, and we will find out meron na bang gamot, ano na ba nangyari sa vaccine, and what is the situation right now on the ground, because it is the companies involved in medicine who actually do engage in all the research and studies. So we will get a better picture, a better understanding, and a handle on the problem of dengue. Now, before all of that, of course, we just want to thank all of you who watch us via Cignal TV, but also those who catch us via Facebook and YouTube, where Cignal TV is not available, particularly to our friends abroad. May mga kaibigan po tayo who watch the program in Europe, Canada, and even the US. So thank you very much. Also, of course, those who watch our replays. Let's get started with the day. And today, it's a daily starter time. Our daily starter is from orator, lawyer, and writer Robert Ingersoll. Nothing discloses real character like the use of power. It is easy for the weak to be gentle. Most people can bear adversity. But if you wish to know what a man really is, give him power. This is the supreme test. That is from Robert Ingersoll. And we use that daily starter today just as a reminder for everyone. When you start choosing, appointing, electing, or siding with people, make sure that when you give them power, they will not be changed by the power, but they will use the power to introduce good change, positive change. Sabi nga ni Steve Harvey, the comedian, presenter, he said that money is not the problem. If you have no money, it shows your character. It shows how patient, how forbearing you are, how hopeful you are. If you have no money, if you have so much money and you were, hindi ko nasasabihin yung words niya, if you're a pain in the butt, okay, you will be a bigger pain in the butt when you have more money. So yan po, money, power, reveals or exposes a man. Okay, let's now go to the front page of the Philippine Star. And today, October 4, 2023, the headline is LTFRB OK's 1 peso hike in minimum public utility jeepney fare. Starting Sunday, the minimum fare for public utility jeepneys nationwide will be 13 pesos after the Land Transportation Franchise and Regulatory Board approved a provisional 1 peso increase. Meanwhile, at the top of the front page, Marcos administration gets lower approval on key issues according to Pulse Asia. So, yan po, no? It is yet another signal to our government and government officials that people are not happy. Do not turn it into a political issue. It is simply a matter of poor performance, underperformance, failure to deliver the services that you promised. Okay. Meanwhile, Quezon City named most competitive LGU anew. According to the Department of Trade and Industry, Cities and Municipalities Competitive Index for the third time. So yan po, yun naman po talagang Quezon City has become has improved so much, and they deserve the recognition. Meanwhile, the government is ready to lift rice price caps. The government is ready to lift the rice price ceiling it imposed on rice due to decreasing prices in the global and domestic markets and the expected increase in the supply of the food commodity, according to the DA. That center photo of the front page of the Philippine Star, nako po, pag yan ay hindi binasa ng viewer, baka kung ano ang isipin. That photo of two SWAT personnel at the NAIA is a simulated exercise, mga kaibigan. Hindi po yan the real McCoy. It is a simulation of a terrorist attack, and those two gentlemen are from the Philippine National Police Aviation Security Group, who are just part of the people who took part in the exercise yesterday. Okay. Meanwhile, 3 YouTubers to face raps for interviewing Bantag. 3 vloggers will face contempt charges for interviewing the former Bureau of Corrections Chief Gerald Bantag, who is a fugitive from the law, and posting the video on their YouTube channel, according to Justice Secretary Jesus Crispin Remulla or Boying Remulla. That, of course, is the right or option or idea of the Secretary of Justice, but that is beginning to open a can of worms because, as posted in many social media platforms, bakit yung mga nag-i-interview kay Arnie Teves, the congressman fugitive or former congressman, now wanted fugitive, are treated differently from bloggers. So it is going to cause quite a stir, and I don't know how Secretary Remulla is going to navigate this matter because as they say, be careful what you begin. Sabi nga ni Fernando po, umpisahan mo, tatapusin ko. Iyan na po, no? Okay. Meanwhile, in the field of sports, We have Phil-Am gymnast to join Yulo in Paris. Gymnast Alea Finnegan has qualified for the 2024 Paris game following her performance in the all-around of the World Artistic Gymnastic Championships in Antwerp, Belgium. To the right of that photo on the front page, we have the Sepak Takraw team adding another medal to its Asian Games campaign in Hangzhou, while the Gilas Pilipinas team nipped Iran 84-83. Kumbaga, parang diesel na nasa malamig na lugar, dahan-dahang umiinit ang Team Philippines. Hopefully, we will climb higher in the ladder of position in gold in Asian Games. Meanwhile, last but not the least, cops back to using whistles and batons. This I got to see. Following the death of 2 teenagers at the hands of police officers, the Philippine National Police will again be issuing whistles and batons to its personnel, according to PNP Chief General Benjamin Acorda. Okay? Some lang naman pala. Hindi naman pala all. Sana all, just like they do in the UK. But anyway, that's all the news we have on the front page of the Philippine Star. We will now go for a quick break, and when we return, pag-usapan natin yung problema sa dengue. We have a problem, and unfortunately, our colleagues in the media have essentially kept it in the inside pages. We need to bring it to your attention. We'll be right back here on the program.
Did you know that half of the world's population are living under the threat of dengue? According to the World Health Organization, about 390 million dengue infections are reported annually. Cases of dengue fever, considered a top 10 global threat, have risen 30-fold in the past 50 years due to travel, trade, urbanization, and climate change. Many dengue infections are asymptomatic, but severe cases of the disease can lead to deadly complications. But that's not all. Dengue has also caused 500,000 hospitalizations per year. Large outbreaks of the disease could quickly overwhelm healthcare systems, particularly in developing nations. It can even impact a country's economy as tourism, investments, and productivity can also get hit. How should government address this health issue? Let's discuss this on today's agenda.
Lo-Ann Villanueva is the country manager of Takeda Healthcare Philippines. In her 18 years of experience in the pharmaceutical industry, Villanueva has worked with various countries like the Philippines and Belgium. She is also the treasurer of PHAP Cares, the social responsibility arm of the Pharmaceutical and the Healthcare Association of the Philippines. Joy Pabellon serves as the medical affairs head of Takeda Healthcare Philippines. Pabellon has over 10 years of experience in the pharmaceutical industry and 5 years of experience in public health. She earned her diploma in pharmaceutical medicine and management from the Ateneo School of Business.
Good morning, ladies. Welcome to the program.
Good morning, Cito, and thank you for this opportunity. And good morning to all your viewers.
Okay, you already know why we invited you. It is because I am paranoid about dengue, because I have seen kids and adults, including my wife, suffer from dengue. And I know that in many cases, it is no more than like a flu, but in the worst case scenario, it will keep you in bed for a week, 2 weeks, or land you in the hospital, and has even taken the lives of young people and senior citizens. But before we get into that, Lo-Ann, could you just give us a brief background of your company, Takeda? Because, we're used to hearing about American pharmaceutical companies. We hear about European firms in the field of medicine, but I must confess, this is probably the first time we've ever had a Japanese sounding. I don't know if it's Japanese, but Japanese sounding company. So, could you give us an introduction of the company, please?
Yeah, sure. Thank you, Cito. So, Takeda Healthcare Philippines is actually a global biopharmaceutical company. And you're right, we are a Japanese company. Our headquarters is actually in Tokyo, Japan. And our efforts in the Philippines started way back in 1968. And a lot of our efforts have been focused on broadening patient access to treatment for rare cancers, rare diseases, and hopefully vaccines in the future.
I find that very unusual because Japan is well known for being a very healthy nation. In fact, it was featured in one of the blue zones where people get to live over 100 in community. And but for Takeda, do you have any idea why the focus on rare diseases? Is it because of the scientific side to Japanese, or is there any reason why rare diseases?
Yeah. Well, for us in Takeda, our belief is that we need to be able to serve patients who need the highest medical attention. And we feel, rare cancers and rare diseases is one of those specialty areas, and we feel that our expertise is really in those oncology, gastroenterology, and also rare diseases. We felt that we can make the tremendous impact in being able to provide access to treatment, especially for patients in developing countries, like the Philippines. And we take inspiration, especially from Japan. And as you've said, maraming nabubuhay na over 100 years old. So hopefully we can copy and mimic that too in the Philippines.
Yeah, they're doing something right, and one of which is the I was it I forgot the place, but where they live up to 100 plus. They eat sweet potatoes like we eat rice. So I've started doing that myself. But anyway, let's go to the subject matter for today. Doc Joy Pabellon, you are a physician, and of course you also have an MBA. But I'm sure your group has been monitoring, following the developments regarding dengue, and I have to say that I am sad that the media has not been giving it the front page coverage that it used to in order to save lives. What's happening on the ground right now?
Yeah, actually, we recently had this dengue forum where we were able to invite some of the experts from the Department of Health, where they did give us a background on what's happening in the country. We see that there are around 5,000 cases of dengue every day. They did give us an overview that it is a little bit lower than what we usually see in the past 5 years. And we have seen that a lot of these cases are still among the age group of 9 and below, or between 0 to 9 years old. And so we were very fortunate that we got to invite these experts, because at the end of the day, the Department of Health does have the data, does have the surveillance and epidemiology data for the Philippines, for the country. And
Okay.
we do know that,
Yeah,
okay.
good. Sorry. I thought you had finished.
Yeah,
Go
and
ahead,
we do know
please.
that globally, we see that around 3.9 billion people will probably be at risk for dengue in the next few years. And we hope that we can do something about that.
Okay, so this is not, like I mentioned off cam, it's not a Q&A, Lo-Ann, Joy. So just join in at any point that you want to make a comment. But where are we in terms of gravity of the situation? Because I remember before COVID, mabanggit mo lang yung dengue, parang may sensor na ang tao, Lo-Ann, ano? You know, it's like people were like, what? Dengue, meron bang dengue? And practically every barangay was spraying their neighborhood.
Yeah. Well, tama ka dyan, Cito, no? Actually, maybe just to provide a bit of a trivia also, ang dengue sa Pilipinas has actually been causing problems in the country for almost a century na. Ganun na katagal, diba? And in fact, you're right, bago mag-COVID, I think sometime in 2019, almost 500,000 cases of dengue was recorded in the Philippines. And tayo yung parang pinakamataas na recorded cases globally for dengue. That was before COVID. And nasabi nga ni Joy kanina, no, Department of Health actually shared the statistics in a recent dengue forum na every week may 5,000 cases tayo since June of this year. And I think ang worry or concern ng mga tao, lalo na ng parents like me, no, and yourself, Cito, no, because school is already face-to-face now. And then at the same time, it's raining hard in Manila. Sabi nga nung kanta, no, it's been raining constantly. So parang we believe this statistics will continue to rise. And therefore, parang sobrang importante na ibalik yung agenda on the importance of dengue management and control. And I think what we've learned from the COVID experience, the way to overcome the COVID, and maybe also for dengue, is really to have a very holistic, very comprehensive, whole of society approach. And hopefully we can do that in the next few years.
Yeah, Doc Joy, the 5,000 cases, was it weekly or daily? Weekly, no?
Every week.
Okay, so if it's weekly compared to pre-COVID times, are we in a good situation? Not that not that it's not a problem, but before COVID, we had so many cases. We had the highest amount of cases. Right now, nakaka 5,000 lang tayo a week. Does that mean we're managing the disease better? Is there better sanitation, or are people not reporting?
There is that big possibility, Cito, that a lot of people probably, because the symptoms of dengue are usually fever, which is something that we also see with COVID. We know that we just recently came out of COVID, 2 years, 3 years that people have been thinking about COVID. So I think it's more about reporting, more about what comes to mind if ever they do get sick with fever. They would think more about COVID now rather than dengue, unlike in the past, in 2019, where we had almost 500,000 cases. We used to think about dengue first, but now we think about COVID first, and that's why maybe the reporting has gone down. Also, we understand that in the past years, there has been a lot of change and better management of these cases as well. And I think the government is doing a lot. Even the local governments are doing a lot in terms of paano talaga natin siya mape-prevent. We have the 5S. We see a lot of our local governments starting the campaign that as we started the rainy season from June. Now with the kids going to school, like what Lo-Ann said, they're trying to make the awareness, build the awareness as well in the local government. So I think we do see that awareness building after COVID is a big thing, and I think people are now more aware. But the lower number of cases maybe because we think more about COVID sometimes more than we think about dengue when we go to seek help.
Yeah.
Well, I think that as was suggested by the video or the information I gather, the problem is there will be confusion between the two types of disease, and that's ironic because both are killers. It's just a question of who the victim is, Lo-Ann.
Correct, correct. That's correct. And I think I mean to be fair for to our country in general way back in 1990s pa nagkaroon naman na tayo ng National Dengue Prevention and Control Program. And this program actually comprised of vector control, meaning really making sure that we address the breeding sites of mosquitoes. And usually it's done through fogging and other environmental control measures, making sure the community is clean. For example, there are also programs in place in terms of disease surveillance, case diagnosis management, outbreak response, gumagaling na rin tayo dyan. And at the same time, health promotion and advocacy. A lot of efforts as well to in place by the government. However, I think looking back, despite all of these efforts, we see that we still struggle in really reducing the cases of dengue in the country in the same manner as the other Southeast Asian countries. Actually, Cito, ang very alarming ngayon is that Philippines would have the highest or one of the highest case fatality rates in Southeast Asia. And ang medyo hindi maganda sa atin is that majority of these deaths are actually among children, 9 years below, and the elderly. So something has to be done. And I think that the important thing to highlight is despite all the interventions that we've done in the country, there seems to be a need for new and innovative interventions.
Yeah, and it doesn't help that because because of the lockdowns during COVID, a lot of people got into gardening, planting, staying in their farms, and then ayun, may mga tinamaan na ng COVID, tinamaan ng dengue, and there's a confusion. So, Doc Joy, how can people make distinctions? Kasi I remember that when my wife Karen had dengue, she thought she had the flu. Kasi masakit yung mga joints niya, she had malaise, no energy. But then I said, okay, come on, we better have you tested. So we had her tested, and true enough, she had dengue. So how, aside from blood screening, what are the initial symptoms, and how do you differentiate between COVID, the flu, and dengue, or good luck?
Good luck. So actually, you're right. The symptoms are the same: fever, headache. We do see that with flu and even COVID as well. We see muscle pains, body malaise, which means you feel down. You're not. You feel fatigue, and these symptoms are the same for COVID, dengue, and even flu. And that's why it's very, very important to seek early consultation. I think that's part of the 5S, as we say it. And it's the only way that we can differentiate, because you already said it, Cito, is really through getting a blood test. It is the only way that we can differentiate.
Yeah. I think the key word is early consultation, because we learned that especially during COVID. maraming nagteka-teka, kakateka-teka na todas.
Correct. Correct.
And I'm just putting some rhyme into it, but it doesn't take away the tragedy that people died because they were hoping it was just a fever or it was just a flu, etc. Pero yun po, no, it can either be COVID, it can be dengue, or it can be the flu. Now, Lo-Ann, what's the community of physicians, pharmaceutical companies? What is everyone in the healthcare doing moving forward? What can be done? What is being done?
Yeah, I think we have a lot of lessons to be learned from the COVID pandemic, and I think that is a good baseline or framework to refer to, whether you're from the government sector or from the private sector. I think what really helped us is having an integrated, what they say as the whole of society approach, where there's updated surveillance, there's widespread educational campaign, may disiplina sa pag-implement ng mga preventive measures, and also providing timely access to treatment at local level. So all of these efforts are actually the agenda also of the Pharmaceutical Healthcare Association towards any disease in particular. But specific to the lesson from COVID, I think the important ingredient there was actually the availability of vaccines. But having said that, nakita rin natin that there was a glimpse of negative impact of misinformation, right? So like what you said, parang nag-aantayan hanggang sa natodas na, no? So I think there is an opportunity for the industry as well as working with the government to really rebuild the confidence in medical interventions, and specifically for vaccine safety and efficacy. And we need to learn from the past, to ensure that we would have sustained faith in the new medical interventions that are being provided by the pharmaceutical industry. So, having said that, our hope talaga in Takeda, is that sana the new generation vaccines for dengue can potentially be considered in the future, so that we can really address the incidence of dengue in the Philippines.
Before we go into vaccination, vaccines, etc., I'm just curious because if my memory serves me right, Japanese scientists and experts were also in the forefront, or took the initiative to develop a way of testing for COVID, not just vaccine, but for testing. Is Takeda, or is there any organization trying to develop a cheaper, faster way for testing dengue? Because there were people who commented on that. Ang hirap naman kasi, sir, sa dengue, kailangan mong umalis ng bahay, pupunta ka pa doon sa laboratory or doon sa hospital, and then magbabayad ka, and then maghihintay ka ng test result. And, with COVID, the world, or companies like, the pharmaceutical companies came out with test kits, and that really helped in the battle against controlling the spread of COVID. So in dengue, meron na ba tayo yung mga swab test, or talagang, kasi kailangan ba talaga sa blood lang? Medyo
Takot na takot ka sa turok nito,
hindi. Hindi ako takot sa turok. Nagkaroon na ako ng medical condition where they had to take blood out of me every week. So I'm so used to it. But I just imagine some people would like, hello, pwede ba bubutasan ko? But diabetics do it. Diabetics have a sugar monitoring where they prick. What about for dengue?
We do have rapid tests for dengue, but again, we do not have the same kind of rapid tests that we have for COVID, like what we use at home. The rapid tests need to still be done at the hospital setting. So at this time, this is how dengue is still tested. So hopefully in the future, we hope that we can see that. But at the moment, we do have rapid tests, but these are still need to be administered by the right people in the hospital setting. So, yeah. So
Okay.
there a
We'll
lot
do-
of things are being developed for it.
All right, let's go for a quick break, ladies, and when we return, we can venture on to vaccines and what other steps are being taken by all the stakeholders so that we can put dengue under control before it makes us globally famous again for having the highest number of cases before COVID. Okay, we'll be right back here on Agenda.
Even if dengue is one of the top illnesses in the world, the development of a vaccine for it has proven to be a difficult task. In 2015, Mexico approved Sanofi Pasteur's Dengvaxia, the first dengue vaccine. However, concerns began to arise when it was revealed that the vaccine could lead to more severe symptoms for individuals who had not been previously exposed to dengue. This concern also became an issue in the Philippines dating back to 2016, and it may have impacted immunization for other diseases, not just dengue. According to a UNICEF study, confidence in vaccines for children has decreased by about 25% in the Philippines. A May 2023 Vox.com article, meanwhile, reported that there are approximately 5 other dengue vaccines in development as of 2018. How can health experts assure their safety? Let's discuss that further on today's agenda.
Okay, still with us are Doc Joy and Miss Lo-Ann, both representing Takeda Pharmaceuticals. And okay, I'll start with you, Lo-Ann, you started the conversation regarding vaccines. Where are we as far as vaccines are concerned? And then I'll go towards the facts and fiction regarding vaccine.
Yeah. But Cito, no, I think for as far as vaccination is concerned, we still have a long way to go to achieve our desired coverage rates, and I think it's quite clear, na medyo tinamaan tayo, with a lot of the vaccines hesitation brought about by some of the issues in the past. And we've seen that also with COVID, medyo mabagal yung uptake ng COVID vaccination rate natin at the start. And we've also seen the impact of vaccines hesitation in our measles vaccination coverage. And hopefully that can be addressed soon. Kasi sayang naman, there are interventions that are available that can actually help protect and save lives. And to date, vaccines is one of the very important scientific discoveries, and that has been proven scientifically to address certain health diseases and really address them, and hopefully we can eradicate them in the future.
Okay, now as far as facts versus fiction is concerned, because I publicly stated that my daughter, who was in grade school at that time or middle school, took the vaccine for dengue. She was one of, I think, the 7,000 or 70,000 school children who were given the vaccine before critics made a case against it. And to this day, she's now living abroad, but she never got dengue. But no one has ever made a report, analysis, or presentation on how effective that vaccine was. So parang wala naman nang nadinig na mga tumaas na cases after that. Wala tayong nadinig. We didn't hear about any child or school children dying, etc. So I just feel like it was a major lost opportunity.
Yeah. And it was unfortunate, I think, Cito, that led Philippines to that issue, before specific to the dengue vaccination. I think that's why at this juncture, talagang importante na i-rebuild, yung faith and confidence about new interventions, such as new generation vaccines, specifically also for dengue. Kasi what we've seen is that despite nga na ang dami na nating efforts in the past, talagang sometimes the missing link is really vaccination. We've seen that in measles, we've seen that in COVID, and hopefully, in eradicating dengue, which is really the wish list of everyone, sana we can consider new technologies also, and that would include vaccination.
Okay, now, Doc Joy, it was said in that video report that there was a 25% drop in immunization for the Philippines, according to the UN. Now, how many million is that? How many million children, Filipino children, are walking around without protection from diseases?
Actually, in the last, we did a sort of catch up. The DOH did a catch up for measles vaccination in last summer, which started, I think, in April, because we do see, we've seen in the reports from the UNICEF that our target for immunization is way below what we want. So it's, I think, around 60%. Again, I am not the expert for this, but it's around 60%, and which is way below how much we want our kids, our children to be vaccinated. This is across all the EPI vaccinations that we have for the country. And I hope that we, after COVID, where we did see a slow uptake, but we did see that a lot of people started getting vaccinated. I think we were able to reach our target of around 70%, at least 70% for the population. And I hope that with this, what COVID can or probably do is bring back the confidence that people would have in vaccinations. I think that COVID was a positive way by which people would see that now, because of vaccination, we're out again in the world. We're not locked down in our households. Children are able to go back to school. They actually lost 3 years of having interactions with peers, and I think that kind of significant change in the way we are now after 3 years would bring back that confidence in how people see vaccination. in general.
Okay, Lo-Ann, what is Takeda's primary program or focus right now? Because I've interviewed other companies on the show, and they would be talking about a specific activity that they focus on, and it can be about diabetes control, etc. So may kanya-kanyang program and platform yung mga companies and communities. Now, for Takeda, what is focus?
Yeah. So kami kasi sa Takeda, no, we believe na there is a continuing threat of dengue in the Philippines. And our belief is there is a need to consider an integrated approach. And an integrated approach which combines dengue management, prevention, and control using new technologies. And we're happy to share that even the government of Japan is actually supporting this initiative. So we're actually collaborating also with the other Japanese companies in the Philippines so that we can help support the 5S program ng Department of Health. O nga pala, 5S, it stands for search and destroy the mosquito breeding sites. The second S is self-protection, which is, using mosquito repellent. The third S is seek early consultation. Yun ang pinaka-importante, kasi kailangan ma-diagnose ng maaga. And then the fourth S is about supporting fogging and misting, lalo na dun sa mga areas na mukhang tumataas yung incidence ng dengue. And the last S is about sustaining hydration. So we in Takeda, together with the other Japanese companies in the country, we're actually supporting the 5S program. And I hope that we can really win the battle against dengue in the near future. And while we recognize the importance of a comprehensive campaign to educate the community, kailangan maganda yung communication strategy, kailangan maganda yung surveillance system. Ang hope and desire sana namin is we'll be able to contribute by making sure that we also have dengue vaccination also in the future. And to that end, Cito, I also wanted to share that in just a couple of days ago, the World Health Organization Expert Committee on Vaccines have actually recommended that vaccination for dengue should be considered for introduction in settings with high dengue disease burden and countries where there's high transmission intensity. So if you look at those factors, parang Pilipinas yon. Diba? So we have very high disease in this disease burden in the Philippines. We have very high transmission rate, and therefore, there is a call from the WHO to consider interventions like vaccination so that we can help maximize the public health impact and minimize yung risk, especially for those who have not had dengue yet. Like myself, I haven't had dengue, and that's why I'm really worried and concerned, and hopefully I can really get protected in the future.
Well, you're relatively young, and I think there are a lot of senior citizens who are at my age who take dengue for granted. And I have to emphasize this, mga kababayan, ladies and gentlemen, getting dengue when you are a senior citizen, I am told and I have watched, is one of the most excruciating, painful experience because it just really messes with your nerves, with your blood vessels, etc. I don't know, Doc Joy, can you elaborate or paint the what it looks and feels like if you are a senior citizen? Kasi mga bata, they'll just curl up in bed and they'll just be weak. But I've talked to a number of senior citizens and they tell me, pare, I wouldn't wish it on my worst enemy because it is painful. Doc Joy?
Yeah, we do see severe dengue. Now, recently, this is a very different trend from what we've been seeing in the past years. This was also highlighted in what the DOH said about the trend among senior citizens. So, Cito, actually, it's like you actually got that on the dot. We want to show as well that we shouldn't just say that this is a disease for children, but we are seeing a lot of cases and even severe cases where the case fatality rate is increasing among those who are senior citizens, 60 and above, exactly like you said. So And yes, when these seniors would usually have it, there can be a lot of joint pains. There can be complications related to other systems in the body, like their heart or their lungs. I just to share, my father actually had some. Well, we weren't really able to like zero in, but it was a dengue-like disease where it was so severe and he really had to be hospitalized. And again, this shouldn't be something that the elderly should not think about. So again, seek early consultation is very, very, very important.
I mean, is it true that, it also involves internal bleeding?
Sometimes, if you get severe dengue, we call that dengue hemorrhagic fever, where these patients or these cases would have very severe bleeding, which could be manifested as internal bleeding. And those
Oh,
are the things that we would lead to fatalities, and those are the things that we want to prevent, definitely.
okay. Now, going back to the vaccine concern, Lo-Ann, what is on the horizon? What are the plans? Because is there a push for the DOH for, because you mentioned something interesting earlier that we have in common, that we need to promote awareness and awareness of the disease, awareness of the 5-point program of the DOH, and also for vaccination. So I think what you guys need are champions, people who will say, I believe in this. Because like here on the program, I keep telling my friends who are watching, hello, naiwanan ko na kayo. Ako naka-fifth vaccine na ako for COVID, naka-bivalent na ako. And people will tell me, teka, paano mo na naman kami naunahan? Wala pang announcement ng government. Saan ka na naman nagpunta? So, I
Oo.
mean, I think when people hear, the inggit factor comes in, the fear factor comes in, but also the trust factor plays a major role for people to buy in or follow the program, Lo-Ann.
Yeah, and you're right, Cito, trust is really a very important ingredient in any communication or educational campaign related to preventing diseases, and more so for dengue. How I wish na bawat Pilipino proactive like you, Cito, in seeking information and in really, asking for guidance on what would be the best health intervention and not to really protect you against the disease. And I think the history has already told us that vaccines is actually one of the notable achievements in scientific discovery. In fact, parang the estimate is that about 2.5 million lives are saved every year thanks to
Mhm.
vaccines. And we've actually seen that also with the recent COVID pandemic. But having said that, it also underscores the importance of having safe and effective vaccines. And to that end, for Takeda, we've really focused a lot of our efforts, a lot of investment in developing a dengue vaccine, which has been licensed in over 20 markets as I speak, including Brazil, Thailand, Indonesia. And on our part, we filed our submission to the Philippine Food and Drug Administration, and we are awaiting guidance and whether they would need more information about our data. We've actually submitted over 1 million pages of data for our dengue vaccine, which would include data from our 4.5 clinical trials, which included some respondents in the Philippines actually. So hopefully,
I'm yeah, good.
we would have the chance and the opportunity to complement the efforts of the government, specifically the 5S framework, and hopefully we can have the chance to introduce this vaccine in the Philippines also.
Okay, I'm just curious. Are vaccines part of the prohibited products from advertising? Because because of COVID, vaccination has been promoted in massive scales. So I'm wondering, baka naman pwedeng ma-exclude ang vaccines or they're excluded and therefore it can be promoted in various platforms and so people can go parang kung gusto mo pa-vaccinate ka, kung ayaw mo your choice, di ba? But I think it is the public awareness that stops people because I was in a Watson's department store Watson's pharmacy the other day and biglang may lumakad na babae bata sabi, meron po kayong binebentang COVID vaccine parang ganun na ba yun nabibili na ba dito yun hindi ko alam yun
Well, unfortunately, Sito, so ang bakuna kasi is considered that as an ethical product. So therefore, the information specifically about vaccines, any kind of vaccine will have to be sought from a healthcare professional like Joy. But having said that, it doesn't stop us or other stakeholders to actually promote the importance of vaccination. Sabi nga nung isang expert natin, the late Dr. Sally Gatchalian, ang sabi niya, vaccines, it's not about vaccines, it's about vaccination saving lives.
Okay, so you can actually come out with plugs or video material on social media, on traditional media, to remind people that they should go for vaccination.
That is possible. So I think it starts with creating awareness about the continuing threat of the disease. Kasi sa atin, sa mga Pinoy, kailangan nire-remind tayo na nandyan pa rin talaga yung threat ng dengue. So I think that's one. And of course, the second more important ingredient is really informing people about what are some of the interventions that are possible. So there is 5S, and hopefully in the future, we can introduce another intervention, which hopefully can be vaccination.
Okay, so for the record, as far as Takeda is concerned, you don't have a vaccine as of now.
Not in the Philippines as yet, Cito, but dengue vaccine of Takeda has already been licensed and launched in Southeast Asia, specifically in Thailand, as well as in Indonesia. So
Okay,
kung kaya pa ng budget, pwede pumunta ng Brazil or sa Europe.
Okay, so it's safe to say na you are not talking about dengue. We are not promoting dengue in order to sell a vaccine because you don't have that. It hasn't been approved in the Philippines. So it is really about preventing dengue, mga kaibigan. And I featured this topic because little do Filipinos know, every week, when I read you, every day when I read you the front page of the Philippine Star, there is the metro section that I don't get to read on air because of time constraints. But there, almost on a weekly basis, meron pong report regarding dengue cases on the rise. So I don't want to be an alarmist, but I also don't want you to suffer. Mababawasan ang manunood ng programa ko. Konti na lang kayo, mababawasan pa. Anyway, ladies, thank you very much for your time today, for joining us on the program. Doc Joy, Lo-Ann, thank you very much for your time. God bless both of you.
Thank you, Cito. God bless too.
Okay, let's now go to our closing blessing for the week. And it is from the book of James, chapter 1, verse 12. Blessed is the man who remains steadfast under trial, for when he has stood the test, he will receive the crown of life, which God has promised to those who love him. And I would just like to add to that, ladies and gentlemen, I have undergone some tests this last 2 weeks. And one thing that the Lord reminded me of yesterday, God's will be done. If we truly believe in God, if we truly trust God, then God's will be done. I hope you enjoyed the program today, learned a lot. Please include us in your prayers, and please keep it here on One News.